Brothers and sisters, warm greetings from Sri Balaji Vidyapith, popularly referred to as Sbv. I am delighted to meet you all once again through Channel One. I thank you for your continuous support in this endeavor. Today's topic is about recognizing the importance of non-clinical services and personnel in healthcare delivery. Hospital services represent the conglomerate of all the activities of individual departments directed towards satisfactory patient care. The core hospital services include clinical management and all clinical services. Hospital services are broadly classified under three headings, namely line services, support services, and auxiliary services. Line services are directly related to the treatment and management of the patient. In other words, denote the core clinical services. Support services, though are not directly related to patient care, they indirectly contribute to the management of the patients. Auxiliary services provide supplementary help and support to the line and support services. It is needless to state that the role of support services is considered crucial in strengthening the effort of the clinical team. The support services include nursing, pharmacy, laboratory and diagnostics, dietetics and nutrition, hospital infection control, medical records department, central sterile services department, information technology department and medical informatics, housekeeping, medico-social activities, hospital linen and laundry services. The uninterrupted flow of the support services are a requisite for smooth functioning of the healthcare delivery system. For a comprehensive healthcare to be provided to both outpatients and inpatients, the support services are needed in various areas. They are needed in nursing services. Nursing services support the clinicians in executing the orders and providing care to the patients. Pharmacy services provide the medications and reporting of adverse events associated with the drugs, working in liaison with clinical pharmacology. Laboratory and diagnostics provide support in diagnosis, clinical decision making and monitoring the progress of the treatment. Dietary services provide nutritional support to the patients in the form of dietary modifications customized to every patient. Further, they provide therapeutic diets for the patients. Hospital infection control provide invaluable support in infection control and in management of hospital acquired infections. Medical records department maintain a comprehensive record of patient related material for future reference. Central Sterile Services Department provide sterile equipment and consumable involved in patient care. Information Technology Department and Medical Informatics provide technological support in various facets of hospital administration, which include integration of several services such as pharmacy, laboratory services, diagnostics, medical records and general administration. Housekeeping plays an important role in upholding the general cleanliness and the aesthetic nature of patient care and other areas of the hospital. Medico-social services provide enhanced social support to patients. Hospital linen and laundry services facilitate the provision of clean and washed linen after ensuring all safety precautions.
Good morning. Greetings from Sri Balaji Vidyapith. The role of auxiliary and support services is very important in a hospital setting. I am Dr. Swati Pawar, Deputy Medical Superintendent, Mahatma Gandhi Medical College and Research Institute Hospital, to throw more light on the topic. The line services or the core services as depicted by the broad specialties in medicine and surgery serve patients from a wide catchment area. Each year, Mahatma Gandhi Medical College and Research Institute Hospital, a constituent of Sri Balaji Vidyapith, treats more than 5 lakh adults and children. The hospital offers clinical services in 10 broad and 12 super specialty departments, bringing all services under one roof for comprehensive medical care. The intensive care units are a state-of-the-art class with all emergency backups at the bedside. The outpatient services on an average handle approximately 3,500 patients. Housing over 1,200 inpatient beds, the general wards are spacious, adequately ventilated, clean and illuminated. Currently, our occupancy rate is around 85%. The hospital provides casualty and emergency medical services round the clock, ably supported by fully equipped ambulance services. The hospital has 15 modular operation theatre suites with latest equipments. Several minor and major surgical procedures are performed on a daily basis. Closed circuit televisions are installed at vantage points for medical students to view many an operative procedure from outside the operation theatres. Cardiac catheterization lab provides the much needed service for advanced cardiac intervention, and we take pride in maintaining the golden hour for our patients from the doorstep to the cardiac cath lab table. We have high-end bidirectional machines to analyze and report various parameters in biochemistry, pathology, microbiology, serology, immunology, virology. The laboratory houses molecular diagnostic unit accredited by the NABL. Speaking of imaging services, we have a spiral CT and MRI which are available in the premises. Our turnaround time is around 45 minutes, including the reporting. A special endoscopic suite for upper and lower GI endoscopy is available, along with a computerized RCG and a flexible fiber optic bronchoscopy suite. A 24-hour blood bank is in the state of readiness and alert, and is certainly poised to develop into a full-fledged department of transfusion medicine in near future. The hemodialysis unit operates 24/7 in 3 shifts with 21 high-end dialysis machines. The MGMCRI hospital houses a well-infrastructured, fully air-conditioned master health checkup center for promulgating quality patient care, which is cost-effective. With a workforce of over 700 qualified and experienced nursing professionals, our hospital is well backed for providing quality and personalized care to our patients. Our palliative care wing at MGMCRI eases the pain and suffering of patients. The Hospital Palliative Care Team HPCT at MGMCRI is a multi-speciality team to provide evidence-based, individualized supportive care to patients with long-term and terminal illness. The Gender Care Initiative at MGMCRI was developed to respond to a transgender community needs in recognition that medical teaching institutes can play a key role in adopting standards of transgender care in the local context. The Center for Yoga Therapy Education and Research Sbv conducts scientifically sound yoga therapy program which is delivered in an appropriate individual small group settings for various ailments to our patients. The Center for Music Therapy Education and Research Sbv provides patient services with a focus on salutogenesis and wellness. The Hospital Information System provides reliable, rapid and accountable solutions in day-to-day hospital operations. The central kitchen maintains a high standard of hygiene and functions under direct supervision of an experienced dietitian. The hospital has an advanced waste management system in place, which includes an incineration plant, a modern sewage treatment plant to handle biomedical and other waste in an eco-friendly, compatible and safe manner. I am proud to say that the hospital has received various recognitions by the State Health Authority and the central government in the form of certificates for best implementation of health standards, hygiene in the hospital, etc. This has been possible by the dedication of our clinical and support and auxiliary services. Thank you.
Auxiliary services are essentially services or supplies that are not provided by healthcare professionals, but these services are regarded as vital in ensuring comprehensive healthcare. Auxiliary services include biomedical engineering and equipment maintenance department, stores and purchase department, transport and ambulance services, security services, mortuary services. The biomedical engineering and equipment maintenance department significantly regulates effective healthcare administrations. The department takes into consideration the various tasks pertaining to the working and maintenance of several state-of-the-art laboratory and hospital equipments. Stores and purchase department includes store management in association with the purchase department in enhancing the availability of essentials and patient care related consumables and material management. Transport and ambulance services include diverse modes of medical transportations such as ambulance mediated transport, non-emergency medical transportation, long distance non-emergency medical transportation, stretchers and wheelchair transportation. Security services in a tertiary healthcare setup are segregated under several functional areas. It is essentially aimed at ensuring the security and safety of the hospital premises, personnel, patients, caretakers and the general publics. Mortuary services have been in the forefront in the recent past, particularly during the COVID pandemic. Mortuary services ensure the preservation, ethical handling and proper handover of the deceased to their kith and kin.
Greetings from Sri Balaji Vidyapeeth. As per our world institutional ranking, Sri Balaji Vidyapeeth figures in the A1 band, signifying institution of academic excellence with reference to outcome-based education. Sbv takes great honor in sharing this pleasant news. Sbv feels delighted in announcing that Mahatma Gandhi Medical College and Research Institute, a constituent teaching unit of Sri Balaji Vidyapeeth deemed to be University of Pondicherry, has been granted certificate of registration for performing liver transplantation under the Transplantation of Human Organs and Tissues Act 1994, elaborated by the Directorate General of Health Services, Government of India. It's worth also mentioning that kidney transplantation program is already on at Mahatma Gandhi Medical College and Research Institute, a constituent teaching unit of Sri Balaji Vidyapeeth. It's a matter of great pride to announce that 16 departments in the broad and super specialty areas of Sri Satya Sai Medical College and Research Institute, a constituent teaching unit of Sri Balaji Vidyapeeth, have been empaneled by the Tamil Nadu Chief Minister Insurance Scheme for providing medical and surgical treatment to the eligible patients who are below the poverty line. Sbv rededicates itself to serving the sick and the downtrodden. As a unique offering to Mother India on the occasion of Azadi Ka Amrit Mahotsav, the 75th year of Indian independence, the Center for Yoga Therapy Education and Research, a constituent center of Sbv, has brought out a wonderful edition on 75 significant yogasanas. This indeed would denote our humble contribution to Mother India and also would serve as a small token of a gratitude to the freedom fighters of a country led by the father of the nation.
It needs to be re-emphasized that support services and auxiliary services fortify the quality of clinical services in any healthcare setup. I wish you the best of health. Do remember to continue practicing physical distancing, wearing masks and personal hygiene. Stay safe. God bless you. Jai Hind.